Roberto, please describe your role.
I'm a research professor of prosthodontics and digital dentistry at the University Federico II of Naples, and I'm actually lecturing at an international master course in digital dentistry in the University of Siena.
What materials are currently best to use for prosthodontics?
Well, we have different materials with different kind of aims for our patients. I guess that today between feldspathics, zirconia and lithium disilicates, the last one, the lithium disilicate, is the most versatile to make our preparation very minimal and to give patients good wear resistance and clinical outcomes over time for final restorations. As regards the temporary restorations, I think that CAD/CAM composites or bisaccharates are actually the best because of the polishing and the easy handling for the clinician.
Where are we at currently with regard to digital workflows in prosthodontics?
Well, the technology is running very fast for sure. We have forefront new system day by day. But I guess that in prosthodontics we are mainly interested with the acquisition data for implant surgery, for example. So think about the CBCT or acquisition paths for facial scanners. Whilst for the prosthodontic field in particular, I guess that the main challenge is the perfectioning of the iOS systems, because I'm sure that the future in 5 years, more or less, will be the iOS scanning directly chairside for all the patients and the clinicians.
Tell us about the 3D virtual patient.
The 3D virtual patient is the new frontier of digital dentistry, and all the research is focused on the acquisition of all the data sets regarding the bone volume, the soft tissues, the teeth, and even the restorations, just to mimic and to simulate all our treatments before starting the real treatment. So reducing the costs for patients, reducing the time, and incrementing the comfort for the patient.
And you suggested that there's a few barriers with regard to interfaces and repositories for data.
Yes, definitely. I guess that the digital interface is very important also for the communication with our patients, because all our patients are really technological today, particularly the younger one. And I think that the visualization of the results and the showing of the results to the patient can be very interesting and very important for our development.
What is the role of standards? Talking about DICOM and things. Is all that data DICOM?
Yes, we can have data DICOM. We can have an exportation of these files in STL files just to match the acquisition or, for example, CBCT scanning with our dental lab softwares and clinical softwares as well. So we are trying to move to a kind of open files to match all this information together and recover a unique file that is useful for the surgeon, for the prosthodontist, and for the patient as well.